Watching someone you love slowly dying, well, it's torture. They're in pain, and there's nothing you can do to help. And sometimes people who are terminally ill want to end their own life before the illness does.
The thoughts that go through your mind when you find out you have so little time is everything that you need to say to everyone that you love.
That is Brittany Maynard, the 29-year-old terminally ill woman who sparked a national debate over the right to die. Brittany took her very personal decision public earlier this month. She said Saturday is the day she will take medication to end her life before her illness does.
Here in Maryland, former gubernatorial candidate Heather Mazur brought the issue to the forefront. In April, she vowed to push for what's called a death with dignity law in our state if she were elected. And now, with Brittany Maynard's story getting national attention, more people are becoming aware of it and taking sides on this very emotional and controversial subject.
I don't know what's in my future. I don't know how my disease is going to progress.
Catherine Weber's cancer can't be cured. With treatment, the disease is currently stable and she's feeling pretty good. But when the inevitable time comes, when treatment is no longer helpful, Weber knows exactly how she wants to go.
For me, being able to receive a life-ending prescription, the immediate thought that I had was peace of mind.
I just think a society has to be asked, is this what we really want?
2 years ago, she'd never even heard of death with dignity laws until she watched the documentary How to Die in Oregon in a film class.
You have the right to change your mind.
My mind's not changing.
And what will this medication do?
It will kill me and make me happy.
The film touched her deeply. Diagnosed with metastatic breast cancer herself, she watched her husband suffering years earlier from an aggressive form of lymphoma that took his life within 9 months.
I suspect that my husband would have wanted this option, may have even asked at the end of his illness, and I didn't really understand what he was trying to communicate to me. It's a very, very, as everyone knows, very, very emotional time.
In 1997, Oregon became the first state with a Death with Dignity Act. Voters chose to allow terminally ill patients to request a lethal prescription from their physicians to end their lives. Patients must be adults, residents of Oregon, able to make and communicate healthcare decisions and have a terminal illness that will lead to death within 6 months. Their physician must confirm all of these terms. If and when they choose to take the medication, patients must self-administer it without help from others.
I will die upstairs in my bedroom that I share with my husband, with my mother and my husband by my side, and pass peacefully.
Though the practice has been legal in Oregon for 17 years, Brittany Maynard, a 29-year-old newlywed with terminal brain cancer, became the very public face of the Aid in Dying movement. Earlier this month, she shared her decision to move to Oregon to access the state's Death with Dignity law.
I can't even tell you the amount of relief that it provides me to know that I don't have to die the way that it's been described to me that my brain tumor would take me on its own.
A Gallup poll conducted in May suggests that 7 out of 10 Americans would support a law that would allow a doctor to end a terminally ill patient's life by some painless means if requested by the person and his or her family. National nonprofit Compassionate Choices advocates for death with dignity laws across the country. Maryland campaign and outreach manager Brandy Alexander says even though our state doesn't have such a law, Maryland is ahead of the curve in other end-of-life initiatives.
It's one of the states that has an advance directive registry, which means after people fill out their advance directives, they can house them with the state. And it's also a state that has most laws, which are medical orders for life-sustaining treatment. And those are filled out by a physician with their patient, and it has really helped people's end-of-life wishes be honored.
But there remains strong opposition as well.
It's been something that the pro-life movement has been concerned about since its inception. Something that we saw coming, whereas we take away a right to life on one side, that could certainly contribute to a devaluing of life throughout the entirety of life.
Jeffrey Meister, Director of Administration and Legislation for Maryland Right to Life, equates death with dignity laws to physician-assisted suicide.
Where they've legalized a medical procedure that doesn't actually treat illness, but rather gives in to the worst fears, so often of people struggling to identify why they're here, what is their worth and dignity, by allowing them to end their life and helping them with that. And that's certainly not a path we want to take.
But for Marylanders like Weber, it boils down to having the choice to make your own end-of-life decisions, even if you don't end up using the prescription.
There's something I can do by my own will to call a halt.
Oregon, being the first state to pass an aid in dying law, releases an annual report each year on the act and who is using it. From 1997 through 2013, doctors wrote nearly 1,200 prescriptions under the act. Just over 750 people ended up taking the medication. Now, this practice is also authorized in 4 other states. That's Washington, Montana, Vermont, and New Mexico by legislation, ballot measure, or by court ruling.